I want you to stop whatever you are doing right now and look at your fingernails. Not your nail polish, not whether they need trimming. I mean, look at them. The surface, the shape, the ridges, the color at the base, the way the skin sits around them. Most people have never truly looked at their nails in their adult life. They have trimmed them, painted them, maybe bitten them down to nothing in a stressful meeting, but they have never read them. And that is a problem because your nails right now may be showing you warning signs that your nervous system, your kidneys, your liver, and your brain have been quietly trying to communicate for months, possibly years. I am Dr. William Lee. I have spent my career in neurology with a particular focus on how systemic disease expresses itself through the body's peripheral systems, the skin, the extremities, the nails, before it ever announces itself in a dramatic clinical event. And I will tell you something that surprises most of my patients the first time I say it. The nails are not cosmetic. They are neurological and metabolic data. After the age of 60, your body's ability to compensate for quiet internal dysfunction begins to narrow. The reserves that kept everything running smoothly in your 40s are thinner now, not because something is wrong with aging, but because the biological margin between quietly struggling and crisis becomes shorter with every decade. And in that narrowing window, the nails become one of the few places where the body still leaves a visible trail. Today, I'm going to walk you through 4 specific nail appearances that have been linked in published medical research to 4 serious conditions that disproportionately affect adults over 60. Conditions involving the brain, the nervous system, the kidneys, and systemic metabolism. These are not rare diseases. These are conditions your doctor may not have discussed with you. Not because they are hiding anything, but because a standard 15-minute appointment simply cannot cover everything. The 4th sign is the one I want you to stay for. I have saved it for last deliberately. It is the one I see most frequently in patients who come to me after years of vague, unexplained neurological symptoms. Fatigue, mild memory fog, tingling in the hands, and it is the one that almost nobody connects to their nails. Before we dive in, I want to ask you something. Drop your age in the comments and tell me, have you ever been diagnosed with a vitamin deficiency, a kidney condition, or anything neurological? Your answer is going to matter to how closely you pay attention to what I'm about to cover. And if this channel is new to you, please subscribe now because what we discuss here is information that belongs in the hands of every adult over 60, not hidden behind a medical consultation you have to schedule 3 weeks in advance. Let us get into it. Here is what most people are never taught about fingernails. Your nails grow from a structure called the nail matrix, a band of living dividing cells tucked just beneath the base of each nail. Those cells are not isolated. They are in constant dialogue with your bloodstream, your peripheral nervous system, and your metabolic environment. Every nutrient your body absorbs, every toxin it struggles to clear, every inflammatory signal traveling through your system, all of it passes through the tissue that feeds your nail matrix. Think of it this way. Your nails are like a geological record. A cross-section of rock tells geologists what was happening to the Earth hundreds of thousands of years ago. Layer by layer, your nails do something similar. They grow slowly, about 3 millimeters per month. And as they grow, they encode information about what was happening inside your body during that period. A disruption in nutrition 3 months ago may show up as a ridge crossing the nail today. A chronic metabolic problem may express itself as a persistent change in nail shape or color that has been building for years. After 60, the peripheral nervous system and the nerves that run from your spinal cord into your hands and feet becomes more vulnerable to the effects of nutritional deficiency, vascular insufficiency, and systemic inflammation. And because the nail matrix is fed by peripheral vessels and nerve-adjacent tissue, it often reflects distress in those systems before any other visible symptom appears. Your doctor is not ignoring your nails out of negligence. It is simply that nail examination as a diagnostic screening tool is not standard practice in a routine primary care visit unless something is visually alarming. The result is that signs that could prompt earlier investigation go unnoticed, sometimes for years. So, let me show you what to look for. 4 signs, 4 diseases, and 1 test at the end that you can perform on yourself right now in about 10 seconds. Sign 1, Longitudinal ridging and Parkinson's disease. Risk. The first sign is something most adults over 60 are already seeing on their nails and have been told is completely normal aging. Vertical ridges, lines running from the base of the nail up toward the tip. Sometimes fine, sometimes pronounced enough to catch your thumbnail when you run it across. Now, here is the important distinction. Mild, faint vertical ridging that appears symmetrically across most of your nails after 60 is on its own often a benign feature of aging. The nail matrix, like every other tissue, becomes less efficient at producing perfectly smooth nail plate as the decades pass. But there is a specific pattern of vertical ridging that is different, and the difference matters enormously. What I am describing is ridging that is noticeably deeper on one hand than the other, accompanied by nail brittleness that worsens progressively over 12 to 24 months, appearing alongside even subtle changes in finger tremor, handwriting size, or grip strength. This asymmetric pattern of nail deterioration, particularly when more pronounced on the dominant hand or when paired with other peripheral nerve signals, has appeared in clinical literature in association with early Parkinson's disease. Here is why the neurology is relevant. Parkinson's disease is not primarily a movement disorder at its onset. It is a disorder of the peripheral and autonomic nervous system in its earliest stages. The dopaminergic cells in the substantia that most people associate with Parkinson's are not the first cells affected. Research into what is called the protal phase of Parkinson's, the period that can precede a formal diagnosis by up to a decade, shows that peripheral autonomic dysfunction, including changes in skin and nail health related to nerve supply, can appear years before any tremor becomes clinically obvious. The autonomic nerves that regulate blood flow and sweat gland activity in the fingertips also contribute to the tissue environment of the nail matrix. When those nerve signals become less consistent, as happens in early autonomic dysfunction, nail quality can change in ways that a careful observer will notice. I want to be absolutely clear here. Vertical ridging alone does not mean you have Parkinson's disease. It does not even suggest it in isolation. What matters is the pattern. Asymmetric progression, combined with handwriting changes, combined with any new tendency to shuffle slightly when walking, or any change in arm swing, combined with any loss of sense of smell, which is one of the most reliable early markers of Parkinson's in the protal phase, and one that almost no one connects to the disease until much later. A patient I think about often, I will call him Raymond, was 67 years old and came to me initially because his wife had noticed that his handwriting had become noticeably smaller over the previous 18 months. When I examined his hands, the ridging on his left thumbnail was dramatically more pronounced than on his right. He mentioned that he had also noticed his left thumbnail seemed to break more easily than the right. He had attributed both to the fact that he was right-handed. He had also quietly mentioned, almost as an afterthought, that food had not seemed to taste or smell the same in the past year or two. The combination of those findings, not any one of them in isolation, led me to refer him for a detailed neurological evaluation. His early-stage Parkinson's diagnosis came back confirmed. Because we caught it in the protal phase, his treatment began at a point where it could meaningfully preserve his quality of life for significantly longer than if we had waited for a more obvious clinical presentation. The practical takeaway here is simple. Look at your thumbnails specifically. Hold both hands side by side under good natural light. If the ridging pattern looks noticeably different between your left and right thumbnail, write that observation down. Note whether your handwriting has changed size. Note whether your sense of smell seems different. And at your next appointment, tell your doctor you want a neurological screen. Sign 2. Beau's lines and kidney disease. The second sign is one that often appears suddenly enough that people notice it, but rarely understand what it is telling them. Look at your nails for horizontal lines or grooves running across the nail. Not along the length, but across the width. A single indented groove crossing the nail like a groove pressed into clay. These are called Beau lines, named after the French physician Joseph-Honoré Simon Beau, who first described them in the 1840s. Beau lines form when something disrupts the nail matrix so significantly that it stops producing nail tissue normally for a period of time. When the matrix recovers and begins growing again, the nail moves forward but leaves a groove where the interruption occurred. Now, a single Beau line appearing on multiple nails simultaneously often follows a major systemic illness, a serious infection, a high fever, major surgery. If you had COVID-19 in the past 2 years and now have a noticeable groove crossing several of your nails, that is very likely what you are seeing. That specific scenario became so well documented after the pandemic that dermatologists gave it its own informal name, COVID nails. But here is what I need you to understand. Recurring Beau's lines, multiple grooves across the nail at different heights, or grooves that keep reappearing without any obvious illness. Those tell a different story entirely. Recurring Beau's lines in an adult over 60, without a clear episodic illness to explain each groove, have been associated in clinical literature with chronic kidney disease. Here is why your kidneys filter waste products from your blood, including metabolic byproducts that when they accumulate become toxic to cells. One of the conditions that develops when kidneys begin to fail is called uremia, a buildup of ura and other nitrogen-containing waste products in the bloodstream. These waste products are directly damaging to rapidly dividing cells, and the nail matrix cells divide faster than almost any other tissue in your body. When uremia begins, even at subclinical levels before any dramatic symptom, it stresses the nail matrix enough to interrupt normal nail growth. Repeatedly, chronic kidney disease affects a significant percentage of adults over 60, and in its early stages, it is almost entirely asymptomatic. Most people do not know they have early CKD until a blood test reveals it, but some of those people have been watching the grooves reappear on their nails for years and dismissing them as nothing. There is also a second nail sign specifically associated with kidney disease, worth mentioning here because it often appears alongside Beau's lines in the same patient. It is called half and half nails, or Lindsay's nails. This is when the lower half of the nail appears white or pale, and the upper half, the portion closer to the tip, appears pink or brownish. The line between the two is usually fairly sharp. This pattern has a strong documented association with chronic renal failure. If you see both Beau's lines and a half and half color pattern on your nails, that combination is worth a very specific conversation with your doctor about kidney function. A patient I will call Margaret, 71 years old, had been noticing a groove crossing her nails on and off for about 3 years. Each time she assumed she had been sick with something she had not fully noticed, a mild virus, a bad week. She was not wrong that something had been stressing her system. What she did not know was that her kidneys had been slowly declining in function since her late 60s. When she eventually came to me for an unrelated neurological complaint, persistent leg cramping, and a slight foggy feeling in the mornings, the combination of her nail findings and her symptoms prompted a comprehensive metabolic panel. Her eGFR, the standard measure of kidney filtration rate, was significantly below normal for her age. Early stage CKD was confirmed. Dietary modifications and careful medication management have since stabilized her kidney function at a level where her prognosis is considerably better than if we had discovered this 2 or 3 years later. The practical takeaway here: look across the width of your nails, not just along the length. If you see one or more horizontal grooves and you cannot attribute them to a single episode of significant illness, ask your doctor specifically for kidney function blood tests. A basic metabolic panel including creatinine and eGFR. If you also notice a sharp color change between the lower and upper halves of your nail, mention that specifically and ask about renal function assessment. If you're still with us and finding this helpful, type number 2 in the comments so I know you're there. And if you haven't subscribed, please do. Your support keeps us going. Sign 3. Spoon nails and the brain-body deficiency connection. The third sign is the one that connects most directly to neurological health in the way that surprises people most. Look at the shape of your nails from the side. Most nails curve gently downward over the finger, a soft arc that follows the natural shape of the fingertip. But some nails over time begin to curve in the opposite direction. Instead of curving down, the edges of the nail lift upward, and the center of the nail becomes concave like a small spoon. If you placed a tiny drop of water on the nail and it did not roll off, the nail has spooned. This is called colonia, spoon nails, and in adults over 60, coilia is one of the most important nail signs to recognize, not just because of what it indicates about the body, but because of what it means for the brain. Conychia is most classically associated with iron deficiency, but the connection most people are never told about is this. Iron deficiency in adults over 60 does not just cause tiredness. It causes neurological symptoms, cognitive symptoms, memory-related symptoms, symptoms that, in an older adult, are frequently attributed to simply getting older or even to early dementia when the real cause is a correctable nutritional deficiency. Iron is not just a building block for red blood cells. It is essential for the synthesis of myelin, the protective sheath that coats your nerve fibers and allows electrical signals to travel at full speed. It is essential for the production of several neurotransmitters, including dopamine and serotonin. And it is directly involved in the metabolic function of the frontal lobe, the part of your brain responsible for executive function, memory retrieval, and processing speed. When iron stores fall, and they can fall silently in older adults for many reasons, including reduced dietary intake, medication effects on absorption, or subclinical gastrointestinal blood loss, the brain is one of the organs that suffers early, and the nails, because they are produced by rapidly dividing cells that are highly sensitive to iron availability, can show structural changes well before the neurological effects become obvious. The specific neurological picture of iron deficiency in an older adult often looks like this: fatigue that is disproportionate to activity, difficulty concentrating on things that used to come easily, a sense of mental slowing and sometimes restless legs at night, a persistent uncomfortable urge to move the legs when lying still, which is one of the more overlooked symptoms of iron-related neurological stress. If your nails have been gradually becoming more concave, if the edges have lifted and the center has hollowed, and you have noticed any combination of those neurological symptoms, the possibility of iron deficiency anemia is something your doctor needs to rule out with a simple blood test before anything more serious is attributed as the cause. Because here is the critically important thing. Treating iron deficiency anemia in an older adult who has been experiencing cognitive symptoms can in many cases produce a meaningful and measurable improvement in brain function. These are not irreversible changes in many cases. They are reversible consequences of a correctable deficiency, but they will not be corrected if nobody looks for them. And nobody will look for them if the nail sign that might have prompted the search goes unnoticed. Sign 4. The disappearing lunula and what your nervous system is losing. This is the one I promised you, and it is the one I want you to check right now while we are talking. Look at the base of your thumb just above the cuticle where the nail begins. Do you see a pale, whitish, crescent-shaped arc, like a small half-moon sitting at the very base of your nail? That is your lunula. It is the visible portion of your nail matrix, the living zone where new nail is being produced right now as you watch. In a healthy adult, the lunula should be clearly visible on both thumbs, typically visible on the index fingers, often visible on the middle fingers, less reliably visible on the ring fingers, almost never visible on the pinkies, and that is completely normal. Now here is what I need you to look at more carefully. Is your lunula still clearly visible on your thumbs, or has it shrunk back beneath the cuticle and become invisible? Can you still see it on your index fingers? Has it become a faint suggestion of white rather than a clear crescent? The gradual disappearance of the lunula, a process called absent lunula or nail matrix atrophy, has been documented in medical literature in association with several serious systemic conditions. But the one that most directly concerns me as a neurologist, and the one that is almost never discussed in the context of nail health, is B12 deficiency and its downstream consequence of subacute combined degeneration of the spinal cord. I recognize that is a phrase most people have never heard. Let me explain it simply. Vitamin B12 is one of the most critically important nutrients for the nervous system. It is essential for myelin production, the same protective coating I mentioned earlier with iron. Without adequate B12, the myelin that sheathes your spinal cord and your peripheral nerves begins to degrade. This process is called subacute combined degeneration, and it can cause symptoms including numbness and tingling in the hands and feet, difficulty with balance and coordination, muscle weakness, cognitive changes including memory disruption, and in advanced cases, serious and sometimes irreversible spinal cord damage. What makes B12 deficiency particularly dangerous in adults over 60 is that it often develops slowly, silently, and for reasons that are metabolic rather than dietary. After 60, the stomach lining produces less intrinsic factor, a protein essential for absorbing B12 from food. Many common medications taken by older adults, including metformin for diabetes and proton pump inhibitors for acid reflux, further reduce B12 absorption. The result is that a large segment of the over 60 population is B12 deficient without knowing it because routine blood panels do not automatically include B12 in many clinical settings. And the nail matrix, because it is one of the most metabolically active tissues in the body, shows the consequences of B12 deficiency early, sometimes years before the neurological symptoms become unmistakable. The lunula shrinks. The nail matrix, no longer receiving the nutrients it needs to maintain its full productive activity, retreats back under the cuticle. A patient I will call Evelyn, 73, a retired schoolteacher, came to me after her family had become concerned about what they described as her slipping memory. She was forgetting recent conversations. She was occasionally unsteady on her feet. Her hands tingled at night. Her neurological examination showed reduced vibration sense in her lower limbs, a classic early finding in subacute combined degeneration. When I looked at her hands, both lunulas had completely disappeared. She had no recollection of when she last saw them. Her B12 level came back critically low. She had been taking a proton pump inhibitor for nearly a decade, and her dietary intake of B12 was minimal. With high-dose B12 supplementation, delivered initially as injections because her absorption was so compromised, her symptoms improved meaningfully over the following months. Her balance returned largely to normal. Her memory fog lifted substantially. Her lunulas, while they never fully recovered to their earlier prominence, began to reappear at the base of both thumbs within 3 months. That outcome was possible because we found it. And the first thread I pulled was the lunula. If you're still watching and this helps, type number 4 in the comments. If you haven't subscribed yet, hit that button and the bell so you don't miss any future videos. We have covered 4 signs. Let me give you the clearest possible action plan today. Take your hands to a window with natural daylight. Examine each nail. Hold both hands side by side and compare the overall texture, quality, and appearance. Note whether one hand looks noticeably different from the other, and pair that observation with any changes in smell, handwriting, or sleep you have noticed recently. Look for any horizontal grooves crossing the nail width. Check the shape from the side to see if any nail has begun to concave. And look at the base of your thumbs and index fingers for your lunulas. Take a photograph of both hands. The light should be even, and the photograph should be close enough that you can see the nail base clearly. Date it. Save it somewhere. You will find it again. This week, if any of today's 4 signs matched what you found, write it down specifically. Which sign, which finger, how long you have noticed it, and any other symptoms, numbness, tingling, fatigue, memory fog, leg cramps, balance issues that have been present alongside it within the next 30 days. If you found 2 or more of these signs, or one sign combined with neurological symptoms, do not wait for your annual physical. Call your doctor's office this week. Tell them you want a B12 level checked, a complete blood count, including iron studies, a basic metabolic panel for kidney function, and ask specifically for a neurological screen if any of your symptoms involve your hands, feet, balance, or cognition. The most important thing I can tell you, none of these nail signs is a diagnosis. Every single one of them requires clinical context, your full medical history, your medications, your other symptoms, and your doctor's examination. What these signs are is a prompt, a reason to have a conversation you might not have had otherwise, a thread worth pulling. The neurological conditions we've discussed today, early Parkinson's disease, chronic kidney disease, iron deficiency affecting memory and mental clarity, and vitamin B12 deficiency causing damage to the spinal cord and brain, may seem very different on the surface, but they all share one incredibly important characteristic. They are significantly more treatable, more manageable, and often associated with far better outcomes when they are identified early instead of after the damage has progressed. The encouraging news is that none of these conditions usually appear without warning. In many cases, your body begins sending subtle signals months or even years before the diagnosis is finally made. The challenge is that most people have never been taught how to recognize those early warning signs, so they dismiss them as normal aging or temporary inconveniences. Today, that has changed. You now know what to watch for, what symptoms deserve attention, and when it may be time to have a conversation with your healthcare provider. Your body has been your most faithful companion for 6 decades or more. Every single day, it has been communicating with you through small changes, through symptoms that come and go, unusual sensations, shifts in energy, and even through visible clues on the surface of your skin, your hair, and especially your nails. These messages are rarely random. They are your body's way of asking you to pay attention before a problem becomes much more difficult to reverse. Think about your nails for a moment. Chances are you glanced at them this morning without giving them a second thought. Yet those same nails may represent one of the most honest and accessible diagnostic windows your body has offered you all year. They can quietly reflect changes occurring beneath the surface, long before those changes become obvious in other ways. The signs have been there all along. The difference is that today you have something most people never receive, a vocabulary to understand what your body may be trying to tell you. And sometimes, recognizing a small clue early can make the difference between treating a condition while it's still highly manageable and discovering it only after lasting damage has already occurred.